Hello, welcome to this video. I still remain your favorite nurse, the safety nurse. Now, if you're joining us for the first time, we're currently on a healthcare campaign, female health and everything that concerns it. So if you have missed our previous videos, you can check the link in the comments to watch previous videos where we talked about PCOS and other health conditions. Today is not going to be different. Today we are moving to another health condition, still in the normal way we do it, simplified health information, easy to understand. So we're going to be talking about fibroids. Have you heard about fibroids? Fibroid is a condition that affects millions of women, and I'm sure you may have had family members who have gone through this condition or are still experiencing the same condition, or you may be experiencing even symptoms which you can't trace or link to fibroid. So after this video, you'll be able to understand and know what to do about it. So let's go. We'll be talking about what fibroids are, what causes fibroids, how to deal with fibroids, and also lifestyle modifications. So going straight to the point, what are fibroids? Now, fibroids are non-cancerous growths which are found on the uterus. We can also call it in our lay Nigerian English, on the womb. So now these growths are non-cancerous and can be usually, most of them are not harmful, but these growths lead to a lot of uncomfortable symptoms. So women may experience excessive bleeding as a result of these growths. Some women may experience pain and heaviness just because of these non-cancerous growths. So let's go on to the next point. How do we diagnose fibroids? How do you know that you actually have fibroid? First of all, what causes fibroids? I know you've heard many things like fibroids can be caused by eating this, or by doing this, Now fibroids can be caused by different things. We never really say they are causes because the cause of fibroids is not really known, but there are risk factors. One is being between the age of 30 to 50. Yes. Number two is also being on hormonal therapy, maybe estrogen replacement therapy and all of that. What that does is that it feeds the uterus with more of estrogen, which now leads to the proliferation of these non-cancerous cells and growths. Another risk factor for fibroids is also having a family history of fibroid. If you have family members who have had fibroids, there's a high probability that as a woman you may experience fibroids. Another risk factor can be being overweight. Yeah, you need to take note of this. Now, being overweight disposes you to many diseases, and one of these is also fibroids. So what can be done? What can we do? Before even talking about what we can do about this, I will mention some simple symptoms that you may notice that can be a pointer to fibroids. One may be pelvic pain. You're continuously having pelvic pain. Number two may also be menstrual bleeding that doesn't end within the normal specification of time. Now, and there's a video where I talked about the menstrual cycle, how to calculate the average menstrual cycle and all. It will give you an understanding of how to calculate your menstrual cycle and the average length of the menstrual cycle. Now, if your menstrual period lasts more than 7 days with continuous bleeding, there's high probability that there may be fibroid. You need to check that out. Another symptom that a woman may notice may also be pain during intercourse. Yes, pain during intercourse. We also experience frequent urination. You notice that you are not drank so much water, neither do you have any health condition like diabetes, but you notice that you're always going to urinate. That can also be a sign. So now, what can we do about fibroids? What can you do about this condition? So what can you do? So when you notice any of these symptoms, the best thing to do is to see your healthcare provider. Your healthcare provider may say, okay, let's use the method of the watchful wait. We'll wait and see if these symptoms reduce, and then okay, everything becomes fine. Because remember I said fibroids can be harmless. Another one may be you may need a surgery, or you may need even a hormone therapy or whatever it is, but ensure you see your healthcare provider, see your doctor, preferably a gynecologist, to be able to check you and know more about your condition. What can you do yourself? Now, there are lifetime of modifications to help, or either to prevent fibroids, also to manage it. One of it is dieting. For a woman, your diet is very important. You have to reduce excessive sugars. Make sure you take these sugars and all. I know you love sweet things, but take them in moderation. And that is exercise. If you're overweight, it's better you exercise. Try to shed those weights. It's causing more harm than good. Yes, try to lose those calories so that your body will be very fine. So before we close the curtain for today, I would love you to share this video with those you think need this information. Also, you can like, you can subscribe, and you can follow us. Till we meet next time, I remain the safety nurse. Stay safe.